So mental health challenges continue to grow, and digital technology brings with it so much opportunity to address needs and gaps. But how do we leverage that opportunity? I could not be more excited to introduce this panel of brilliant minds and cool human beings who are doing such inspiring, change the world kind of work to answer this question. So this panel is going to focus on ways in which digital technologies can tackle problems in mental health care across the globe, including access, effectiveness, and collaboration. But you didn't come here to hear me speak, so let's dive in with the first intro. So our first speaker, Dr. Shekhar Saxena, is professor of the practice of global mental health at the Department of Global Health and Population at the Harvard T.H. Chan School of Public Health. A psychiatrist by training, he has served in the World Health Organization since 1998. From 2010 to 2018, he was the director of the Department of Mental Health and Substance Abuse at the WHO. In 2017, he received the prestigious Leon Eisenberg Award from the Harvard Medical School. He's the author of more than 300 academic papers. He functioned as an editor of the Lancet series on global mental health 2007 and 2011, and the Lancet Commission on Global Mental Health and Sustainable Development 2018. His expertise includes providing advice and technical assistance to policymakers on prevention and management of mental, developmental, neurological, and substance use disorders and suicide prevention. Dr. Saxena, thank you so much for joining us, and I will now pass along the virtual mic to you.
Thank you very much, Shimona, and I'm really excited and really privileged to be part of this panel. An important area, digital mental health, and how does global governance and collaboration work or do not work for this. And I'll present some observations based on my work at Harvard, but also before that, as you said, many years of working for WHO, and I having some experience of, especially of countries and communities which are not as rich and perhaps also not as connected as we see in the United States. I go on to really present a concept that we presented, me and many others, as a part of the Lancet Commission on Global Mental Health and Sustainable Development in 2018, which I think is quite relevant for the discussion that we are going to have as a background. We see mental health as a dimension and not as a binary division between people who have mental disorders, people don't. And that is the concept that I think is quite useful for all services, but also more especially for digital services, and actually more relevant for the current times that we are passing through in view of the pandemic. So on the left side of the screen, there is the positive mental health, people who are coping up well, who don't think they have a problem, but still something could be done about them in terms of promotion of mental health. Then there are people who have some mental distress, and something could be done about that for preventing them from distress going on to disorder. There are people, in fact, quite a large number of people who are living with a mental disorder, and they can strive towards remission as well as prevention of relapse. And people who have a disorder or had a disorder and have a stable psychosocial disability, they can go towards the recovery by whatever interventions are available. And so this is the entire spectrum, the dimension of mental health. And so mental health is important for all of us, wherever on this spectrum we might be at this point of time. And obviously in terms of time, we might vary from positive mental health to having mental distress and sometimes having a mental disorder. And during humanitarian crises, including a pandemic like this, we all move towards the right. People who are coping up very well find it difficult to cope well. That includes me. People who have a distress might go into disorder, and people who have disorder go into a larger amount of disability. And that's where we need to intervene, to put people more towards the left as the pandemic is putting them more towards the right. And that is the framework that we need to take for all services, and more especially for digital services. This slide got a little messed up, so I will have to just explain in words what I mean by this. was supposed to be a pyramid of mental health services. At the bottom, there is a self-care and informal community care, which you can actually read on the slide. Above that is primary care and mental health services, and then psychiatric services in general hospitals, and finally at the top, specialist psychiatric services. And the self-care and informal care should be available in the largest volume, practically for everybody, and costs a lot. And as we go up, the cost increase and the volume of those services will need to be less. So only a few people should actually access that. The problem is that this pyramid, which was given by WHO some 17 years ago, is very small for most countries and communities. That means there are less services than what are needed. But the other problem is this pyramid seems to be lying upside down. We have more specialist services and less self-care and informal community care, which means we spend more money and get less out of it. So the objective is actually to put the services in this pyramidal shape and save money and do the maximum with the monies that we have and all the resources that we have. So digital mental health, I believe, can intervene at each of the points of this pyramid, as I will try to show in the next slide. Digital technology for mental health can have various functions at all stages on the entire spectrum, but also on this entire pyramid. They can help in screening and diagnosis of mental health condition. They can obviously help in treatment and care of people with mental health conditions. They can help in increasing capacity for human resources in mental health in terms of initial training, in terms of continued training, and also supervision and support. They can strengthen the mental health care system by many other means, for example, by information technology, by having better referral patterns, by giving a feedback, and all of those things. And finally, at the bottom of the pyramid, they can help in public mental health awareness, education, and building online communities, which actually are thriving using the technology. And so these are some of the ways in which the digital technology can help in mental health, and more from a global perspective. This framework was given by some of our colleagues, and there is a reference at the bottom. And we believe that this should be used in its entirety, rather than just focusing on one or two of these aspects. Since I worked for WHO for a long time, I would like to spend just a few minutes on the role of WHO, existing role as well as possible role. WHO was late in getting into digital health and also digital mental health, but it's catching up fairly quickly. There is a draft global strategy on digital health, and mind you, it's digital health and not digital mental health, which is for the next 5 years, actually. This was prepared earlier this year. It's very progressive, especially for an organization which depends on the acceptance of 194 member states, including USA, which sometimes can be very difficult. But it's very, very progressive on that. It encourages public-private partnerships. It emphasizes capacity building, which is quite important. It sets some minimum standards. It has emphasis on quality control and also on monitoring and evaluation. And it looks for regulatory frameworks at this point of time by national governments, but hopefully in the future by international organizations. So these are some of the roles that WHO assigns for digital health, and mental health is obviously an important part of that. On the technical front, WHO has taken a lead in capacity building on mental health globally, and with more emphasis on low and middle resource settings. And I'm using my words carefully because there are low resource settings in high-income countries and also high resource settings in low-income countries. So we need to really be mindful that we're talking about settings in all countries and in all communities. WHO put forward about more than 10 years back a program called the MH-GAP, and the gap here stands for what is needed versus what is available, which obviously is very large, using non-specialists for delivering mental health care by using routine methods, but also by using digital mechanisms. and it has an elaborate intervention guide, training material, and all kinds of things for increasing the capacity of general doctors, general nurses, and even healthcare workers and volunteers in doing some basic stuff, which is absolutely necessary for expanding the care in low resource settings, because human resources are scarce and we need to use all health resources for delivering those care. And on this slide, you will see the figure of a mobile telephone, and there is an app. Anybody can download it on one's mobile, and it's called MH-Gap Intervention Guide, and it's all digital. So people can access that, people can use it in increasing the capacity and getting trained on the kind of stuff that is necessary. So this is a major advancement using routine as well as digital mechanisms. WHO has also prepared a number of manuals for psychosocial interventions, because it's easy to train doctors and nurses in using drugs, but it's more difficult for them to be skilled in using psychosocial interventions. And WHO has put into public domain some of those interventions and manuals which were earlier under license and also sometimes under fee. So these are very major advancements. They are not all yet available digitally, but there's a rapid process going on now by which all of them will be available on digital mechanisms, so that people can actually download, use, and even do some very sophisticated work with them in training people and also using those things. There is a particular initiative which I want to give an example of, which is by Global Mental Health at Harvard by some of my colleagues. It's called Empower, which is a digital solution for learning, mastering, and delivering quality assured psychological treatments. And this is what the world needs now, because psychological treatment, the gap in how much is needed and how much is being delivered is actually more like 99% as opposed to 80% for the drug treatment. So this is really the requirement. And digital mechanisms can be enormously useful for expanding care and also seeing to it that quality is assured. You may or may not be able to read the fine print here, but just to highlight some of the basic mechanisms, this platform is already providing learning so that people can learn what to deliver, how to deliver, then delivery, actual delivery, and also system integration, so that the different parts of the system are actually in sync, and also providing a mechanism for supporting healthcare providers and even doing a peer review so that they can review each other's performance and can actually not only deliver things, but also learn as they're delivering. So this is the kind of online platforms which are being built, and this will be entirely free for everybody. So it's not under license, it's not a fee-paying platform, and this is the kind of platforms that we really need for going forward. Let me give you a couple of more examples just to make it very practical. In India, which has a very large number of people online, including by mobile technology, there is very recently, in fact, in the last 2 months, there is a digital gateway for mental health. This is part of a health gateway, which is called SWAST, which literally translates from Hindi to English into health. And there is a particular part of it which is dedicated for mental health, and it's a public-private partnership. That means government is behind it, but is using a number of private providers with their own platforms to actually provide a single gateway for the clients. So people can log on to this, they can download it on their mobile devices, and then see what kind of help do they need and which provider will be able to provide that kind of help. Most of it is free, but there is a premium content for which people have to pay, but very transparently. So it can provide help for managing depression, reducing anxiety, stress, and many other things. This is a national platform. India is a big country. And this kind of platforms will be very necessary to take care of the vast number of apps which are proliferating, and nobody knows which one is good and which one is not good. So that's the kind of another example of the kind of gateway which is being done. Just moving on, there is also need for governance and also ethical considerations in internationally as well as nationally. And I'm aware of, in fact, I'm part of another initiative, which is by World Economic Forum and Deloitte. This is a project on digital mental health and is building up a digital mental health ethical governance toolkit, which is components of ethics, regulation, governance, and implementation. It's already being piloted in New Zealand and will be piloted in 2 other countries, mostly from low and middle income groups, so that there is at least a system by which governance and ethics can be in some way made more systematic, but is still doable. Because many times ethics are very high standards which are not feasible, and governance seems to lose its way between the high levels of ethics and the practicalities. So this is the kind of toolkit which is being built and will hopefully be tried in many other countries to bridge that gap between what is ideal and what is at present there. I come to the end of my presentation, and I'll be happy to take questions with you, Mona. The public health implications of digital mental health still is in its infancy, looking at it globally, and there are continuing challenges. There is the challenge of global and national governance. Who globally should be deciding what is good and what is not good? What is quality, what is not quality? What is evidence-based and what is not? And that is a challenge that we still have to face. UN and WHO are in a good state to start the discussion on that and hopefully arrive at some kind of conclusion, but that is absolutely necessary. As I was explaining earlier, there is less attention on capacity building, much more attention on delivering direct to clients. And I think there needs to be some kind of balance between the two, because we're not going to have a system which is completely independent. We need to have hybrid systems, and their capacity building of the routine mental health care will be absolutely necessary. There is a need for public-private partnership, and I was listening to the earlier session where some of those discussions took place. There is need for doing that in high-income settings, but also in low-income settings, where the need is even larger. There is need for regulatory and quality control. Again, we don't know where it will come from, but there is definitely a need for discussion on that. There is need for integration with traditional services, and there is need for discussion on paying mechanisms. If you're delivering by digital methods, how the payment will be done, who pays, is it the client, is it the insurance company? And there is some movement on that during the COVID time, but much more needs to be done, especially in those settings which are in the low resource world. So these are some of the issues I wanted to raise. I stop here and will be very keen to listen to other panel members. Thank you.